Hi, everybody, and welcome to today's episode of Oncology Data Advisor. Today, I have the pleasure of being joined by Dr. Erica Fortune from Cancer Support Community. So last week at the San Antonio Breast Cancer Symposium, Cancer Support Community presented their abstract, Treatment Tolerability and Adherence in People Living with Metastatic and Non-Metastatic Breast Cancer. And Erica is here today to tell us some more about this research as well. So thank you again for coming on today.
Yes, very excited to be here. Thank you.
Great. I'd like to do a quick intro about yourself and what you do at Cancer Support Community.
Sure, absolutely. So I'm Erica Fortune. I'm the Vice President of Research at CSC, and I lead our multidisciplinary team in doing various types of research, which we refer to as mixed methodology research. So that means that we just do lots of different types of research and collect data in a variety of different ways, because we believe that the patient experience and patient voice, as well as the caregiver experience and caregiver voice, is not just captured in one type of research setting or method. So we do things like survey work, as well as interviews and focus groups and even beyond, in an effort to really capture the full experience of patients and caregivers in the cancer space.
Awesome. So in our previous interview, we talked about Cancer Support Community's ASH abstract focus on treatment tolerability and income. And this abstract at San Antonio is focused on treatment tolerability and adherence. So for background, would you like to tell us about what the impact of adherence is in breast cancer?
Yes, and I think that's a really important question, right? So the importance of adherence, not just in breast cancer, but any cancer, tends to be the same. Treatment adherence is critical when it comes to achieving optimal outcomes in that space. It directly affects the effectiveness of your therapies designed to manage your disease and prevent recurrence. So even though we're focused on breast cancer for this specific interview and for this specific work, I want to also mention it's essential across cancer types. And then also point out that poor adherence is going to be related typically to worse clinical outcomes, including disease progression, and unfortunately, sometimes mortality. And the key piece of this conversation, especially as it relates to this work in particular, is how adherence might be influenced by other factors, right? So I think we can say pretty confidently that adherence is important in breast cancer and beyond, but it's really about understanding what is driving adherence. Are there other factors that we can be aware of, and are there factors that we can actually change or adjust that might help patients to better adhere to their treatments?
Great, thanks for the explanation. So what was being investigated in this study, and how did you and your team go about designing and conducting it?
Sure. So at the heart of it is going to be our treatment tolerability and adherence. But before getting into that, I have to first explain where we extract the data. So these data come from our long-standing research survey called the Cancer Experience Registry, which I've mentioned before. So that is, again, a survey that focuses on a wide variety of topics, but the emotional, physical, practical, and financial impact of cancer, as well as working to identify any unmet needs that would exist in this space for patients, survivors, and caregivers. So the registry is open to anyone who's 18 or older in the United States and Canada with any type of cancer diagnosis and any time since diagnosis. So for this specific work that I presented at San Antonio, we extracted our tolerability items. So these tolerability items are really meant to look at the patient perspective and tolerability. So extending beyond what we would traditionally refer to as adverse events and physical effects, but also considering things like access to care and treatment regimens. So how a treatment is given and where a treatment is given and how often, for example. So understanding how important are these factors to patients, but then also how might this be related to adherence, right? So for the tolerability items, we asked people on a 5-point scale from not at all to very much, how important are these factors when you are considering your treatment tolerability from your perspective? And then from adherence, we asked people to what extent they had deviated from their cancer care plan during their treatment, from 1 not at all to 5 very much. So we're really able to understand how much, if at all, people are deviating and not adhering to their treatments.
Great. Thanks for the overview as well. So what results did the study find that you presented in terms of the association between treatment tolerability and adherence?
Yeah, so I think there's a couple of different factors to consider here. But first and foremost, I can say, regardless of any additional types of analyses or subgroup analyses, the three most important factors that came out from the patient perspective when considering tolerability of treatments was the ability to slow disease progression, symptom relief, and side effects of treatment. And these are actually consistent with some of the work that we presented at ASH in the blood cancer space. So it's actually starting to look like there might be some consistencies across cancer types when it comes to extracting the important factors for tolerability. But that full story is yet to be seen. So I would say first and foremost, we found that those three factors, ability to slow disease progression, symptom relief, and side effects of treatment. But that said, we also would want to consider metastatic status as well as how it might relate to adherence. Right? So in our sample of 244 individuals, we had 41 who said they were metastatic and 200 who said they were non-metastatic. And so one factor we wanted to look at is if that differentiation would impact what they would say is tolerable, right? So I think it's important to point out that for metastatic patients, those top three factors I just mentioned remain unchanged. Those were still the top three for metastatic patients. But for non-metastatic patients, we found that potential cure was actually more important than side effects, right? So compared to metastatic, 75% of metastatic patients said ability to cure is important, whereas 98% said from non-metastatic said this is important to me in tolerability. And I think this really boils down to expectations in those different stages of their cancer experience in metastatic versus not, and what they're expecting from their treatments, right? So that's one of the take-home points here is that your expectations in this space as it relates to your cancer stage or status could also come into play. But to go to the adherence piece, which I think is, again, essential and core to what we're discussing here, number one finding is positive in that very few people reported non-adherence. So only 23% indicated at some point in their treatment experience they had not adhered to their treatment plan. And there was no relationship here with metastatic status. So it didn't matter if an individual was non-metastatic or metastatic. That did not influence their adherence. What we found for reasons why people might not adhere, so individuals indicated they wanted to avoid side effects. They thought that their treatment was interfering with their daily activity or it was interfering with their personal life, and so that they did not adhere at some point. But as it ties back to that tolerability piece, right? So those who reported non-adherence were significantly more likely to indicate importance on certain tolerability items. And those were cost and affordability of treatment, impact on daily life, and impact on emotional well-being.
It's definitely very interesting to hear about. A lot of really important findings there. Did you find any of these results particularly striking or significant to you?
Yeah, and it's interesting because I think similar to our last conversation, some of the same pieces jumped out to me as being striking. So number one, that we need to consider the emotional piece, right? So in both of these analyses for the blood cancer space at ASH and then for breast cancer at San Antonio, that emotional impact on emotional well-being as it relates to tolerability came out as a significant factor to consider. So I think one take-home message here is that that should always be top of mind. It shouldn't be secondary to cancer care. The support of emotional well-being should be part of the standard of care process. And then again, health equity, right? Because cost and affordability comes out again as a major factor here when we're looking at non-adherence. Even though in this specific analysis, we weren't looking at income specifically, we're looking at adherence, which some may say is a proxy, right? It might indicate your current or financial status or well-being. So I think this is a health equity issue. So I'll just continue to state that tolerability and adherence, these are health equity issues that need to be continually discussed. And they're not a separate concept. I think oftentimes people like to talk about health equity as it's this special space, and it's not. It runs throughout everything we do, and it runs throughout all of healthcare, especially when it relates to important topics like tolerability and adherence. So I think it has to be top of the conversation always.
Definitely. And it's interesting to have these data to see that these themes persist across cancer types.
Exactly.
Exactly. So how can these results be used to better maximize treatment acceptability and adherence? How can they kind of be translated into practice?
Yeah, and that's a great question and one that should always be asked, right? So we have these findings now. How do we actually get them into practice? Why does it matter? I think that it shows that individual priorities, preferences, and expectations are important to consider, right? So when a healthcare provider is working with a patient to determine their best care options, you can't look at it in isolation. You have to consider the patient preferences. We need to ask them, what is important to you? What is important to you when it comes to tolerability? Because it will potentially directly impact their adherence. And we know from a wealth of literature, like I talked about earlier, that adherence is going to be related to your outcomes. And we need adherence in order to have what we would consider optimal outcomes in this space. So I think really the take-home message is that it just has to be part of the conversation, always asking patients what they want, what's important to them, and what their preferences are.
Absolutely. So same question for this research as well. Any next steps or future directions?
Next steps is just to continue doing more of what we're doing, right? So continue enrolling people in our Cancer Experience Registry, continue to learn about what tolerability looks like across different cancer types, cancer experiences. So for example, in this work, I talked about differences in metastatic versus non-metastatic. That is certainly not the only clinical consideration that we could look at in our data. So really going to our full Cancer Experience Registry and asking ourselves, what else might matter in this space? So beyond our cancer type, beyond our cancer stage and status, what about other specific treatments that they've had, right? Where they are in their treatment journey, what we would call first line versus second line or third line therapy. When does that come into play when we're thinking about our tolerability and adherence? So I really think that we're just getting started in this space, and there are many different directions that we hope to move into in the future.
Amazing. So as I wrap up, any parting messages you have for, first of all, patients with breast cancer about this research, as well as for clinicians who can incorporate it into practice?
I appreciate that. And first, I would say for patients, we're here. We're here for you, and we're here to support you in any way we can. And also, we want to share your voice. So in any way that you feel comfortable sharing your personal experiences with us, I promise that we will do our best to represent that, not only in the research space, but beyond everything in what we do at Cancer Experience or Cancer Support Community. So looking at what we do in our policy space, looking at our programs and our educational materials, we will try our best to incorporate the patient voice in all aspects of that support area. And then for providers, again, it's really just making the space to talk about these types of things. And we know, right, that healthcare providers have a heavy burden. They don't have a lot of time in their appointments in their day, but making sure that we reiterate that emotional well-being, tolerability, adherence, these should be key points of the conversation that we need to make time for.
Absolutely. Well, thank you again, Erica, for coming on today to tell us about this research. It's always wonderful to hear about all the work that Cancer Support Community is doing to help improve care for patients and really incorporate the patient voice.